Evidence-based practice is a silent station in NMC OSCE, like professional values and behavior station in NMC OSCE. This station is silent writing station of 10 minutes duration. This station is similar to professional values station, except of the fact that topics are different and you need to analyze studies given. Fortunately, you will be asked only about one of the following 5 topics to be answered in the station. You should make sure that you learn these marking criteria by heart and answer corresponding to question. The topics asked in evidence-based practice station are the following: diabetes, female myocardial infarction, pressure ulcer prevention, smoking cessation, use of honey dressing for venous leg ulcers. Scenario is usually of a patient who is diagnosed of diabetes and is on tablets for the same. She is concerned about occurrence of hypoglycemia and what she should do in case her blood sugar drops. You will be given 3 studies, which you need to analyze and summarize main findings. As the professional values station, you need the advice in future tense as well. Let's see how you will write the answer in this case. You need to summarize the main findings from the article summary and draws conclusions, making recommendations for practice. Then, I will inform the patient that she is less likely to suffer with hypoglycemia as she is not prescribed insulin. However, hypoglycemia remains a serious concern, and she should be vigilant to monitor her blood glucose levels and to recognize the signs and symptoms of hypoglycemia. I will advise the patient that hypoglycemic episodes are often caused by diet-related factors, such as missing a meal or not eating enough carbohydrates, emphasizing the importance of eating regular meals, and discusses the daily recommended amount of carbohydrates. I will advise the patient to observe for excessive sweating, feeling faint, lightheaded, blurred vision, new confusion and/or nausea, and to call 999 if she experiences any of these symptoms. I will advise the patient to inform friends and family that, if she appears confused or loses consciousness, she may be having a hypoglycemic episode and will need emergency medical help by calling 999. I will inform the patient that an episode of acute illness may cause irregularities in blood glucose, so she will need to monitor her blood sugars more frequently and report any changes. Also, make sure that you memorize the marking criteria so that you won't miss a point. The scenario is usually like a patient gets admitted to hospital with chest pain suspecting a heart attack. Diagnosis is ruled out. She is very worried about her condition and asks what she should do if she experiences this again. Your answer should go like this. You need to summarize the main findings from the article summary and draws conclusions, making recommendations for practice. I would tell the patient that early and correct recognition of these symptoms is vital in order to seek medical care promptly for a better outcome. I will inform the patient that, as a female, she may or may not experience chest pain. I will inform the patient that she may experience nausea and back, shoulder, throat or neck, cheek or teeth and arm pain. I will emphasize on the importance of reporting any symptoms, whether she considers them to be cardiac or not. I would encourage the patient to call 999 immediately if she experiences any of the above. Don't forget to memorize the original marking criteria and practice writing in time as well. Next one is pressure ulcer prevention. Scenario will be like a patient had a laparotomy and is advised to stay in bed for a couple of days and has developed a small pressure sore on the sacrum. T5N has seen the patient and has advised for foam dressing. Patient is worried of worsening pressure ulcer, as well as usage of foam dressing. You need to summarize research findings and give advice on pressure ulcer prevention. Your answer will be like. You need to summarize the main findings from the article summary and draws conclusions, making recommendations for practice. I will inform the patient that a specific foam preventive dressing applied to a person's sacrum has been shown to reduce pressure ulcer development by 10%. However, even with a dressing, he may still develop a pressure ulcer, although it may occur later. I will explain that a very rare side effect of the foam dressing is mild skin irritation. I will advise the patient that, being male, he may be at more risk of developing a pressure sore. I would explain to the patient that regular skin inspections, regularly changing position, staying well hydrated, and maintaining a balanced diet will also help with the prevention of a pressure ulcer. I will inform the patient that there is a foam dressing that may aid in the prevention of a pressure ulcer, and that this will be discussed further with the tissue viability team. Don't forget to memorize pressure ulcer prevention marking criteria. Next topic is smoking cessation. Usual scenario will be a patient under your care is undergoing nicotine replacement therapy for smoking cessation. He has got argument that use of e-cigarettes is more helpful in smoking cessation than the nicotine replacement therapy. You will be given 3 studies showing benefit of nicotine replacement therapy over use of e-cigarettes. You need to summarize research findings and give advice on smoking cessation. Your answer will be like: I will inform the patient that replacement therapies have not been found to achieve the same level of satisfaction as smoking. However, e-cigarettes have higher rates of satisfaction compared with nicotine replacement. I will discuss with the patient that studies show that stopping smoking is more likely when using e-cigarettes than nicotine replacement. I would inform that e-cigarettes are more likely to cause throat and mouth irritation compared with nicotine replacement. I will advise that nicotine replacement therapies are more likely to cause nausea. I will emphasize that, without face-to-face support, there is low efficacy for both treatments, and recommends that the patient use a smoking cessation support service, signposting them to the local service. I would positively acknowledge the consideration of giving up smoking by offering support and encouragement. Don't forget to memorize the marking criteria for this topic as well. Last topic is about use of honey dressing for chronic venous leg ulcers. Usual scenario is like a patient is undergoing treatment for leg ulcer, which is treated as per current evidence-based protocol. Patient has an argument that use of medical honey or honey dressing is beneficial for treatment of leg ulcer when compared to the treatment she is receiving. You will be given 3 studies which you need to summarize and advise the patient. Your answer should be like: I will inform the patient that there is currently no conclusive evidence indicating that medical-grade honey improves outcomes for patients with chronic venous leg ulcers. I will inform the patient that one large study found no reduction in size of ulcer or healing time with honey compared with standard treatment. I would advise that, in the same study, patients reported an increased rate of pain. I would that another study suggests that honey may have antimicrobial properties and may help patients with chronic venous leg ulcers who have a methicillin-resistant Staphylococcus aureus (MRSA) infection. However, this was a very small study, and more research is required on the subject. I will inform the patient that there is no evidence that medical-grade honey is cost-effective in the treatment of chronic venous leg ulcers. I will recommend that, until further robust research is conducted and the efficacy of honey to treat chronic venous leg ulcers is established, the dressing of the wound should be based on current evidence-based trust protocol. To conclude about this silent station, known as evidence-based practice, what we recommend is to make sure that you memorize the marking criteria and practice it, writing down within the given time frame of 10 minutes. Don't forget to visit our website, www.oscetrainer.com, and thanks for watching.